Let's see some clinical cases to know how effective are the microimplants, beginning with simple cases and going to a more difficult cases. For example, is molar intrusion. Molar intrusion without microimplants is very, very difficult, but we can do it very, very easy only with microimplants. First step, this is a molar that should be intruded, bonding a band or a tube and a lingual button or hook. Incision with a scalpel, only mesial or mesial and distal. It depends if we need to control the tip or not. Inserting the microimplants, and we use 6 millimeters or 8 millimeters depending on the thickness of the mucosa in the labial side. And also we need a palatal microimplant to control the torque, and depending on the thickness of the mucosa we will use the 8th length or the 10th length. We will attach an elastic chain or a coil spring in both sides and intrude the molar, and we are able to intrude the molar 2 to 3 millimeters in 3-4 months. So this case is a very common case. This patient has a missing molar in the lower, and for this reason the upper molar strut. Without microimplants, we should make the root canal treatment of this molar and put a short crown, but with microimplant it's very easy to intrude the molar. As the intrusion of the molar will take around 3 months, it is indicated to place the lower prosthetic implant before, and then we intrude the molar. So when we finish the intrusion, the surgeon or the prosthesis specialist is able to place the lower crown. So it is a very nice treatment because we don't need to wait, because while the osseointegration of the lower implant is processing, we can intrude the upper molar. Also, it is a completely aesthetic treatment for the patient and painless treatment. So one microimplant in the labial side with an elastic chain and a button, and also another microimplant in the palatal side with a button and an elastic chain. And we can intrude the molar like this in 3 months. I didn't intrude the second molar because the patient only will have one implant in the lower, and he will extract this molar. But also we could intrude the both, as we will see in the next example. So we can go from here to here, from here to here in 3 months, and we could intrude this molar 2.5 millimeters in 3 months. This case is a case of my colleague, Dr. Casiquinho, and he intruded the second bicuspid and the first molar also in 3 months by using a molar tube and a molar bracket with a sectional wire, one labial microimplant, an elastic chain, and also 2 palatal buttons and 1 microimplant in the palatal side. So this is at the beginning of the treatment with no room for the lower crowns. 1 month later, 2 months later, and 3 months later. with enough room for the lower crowns. And it is a very easy and a very aesthetic treatment. So I think that we have a lot of cases like this, and we can use the microimplant very, very often.